I think the most important things about the opioid crisis is, first, it's not an opioid crisis in a way. It's an illicit drug. It's a heroin and fentanyl crisis. What supposedly began as a prescription opioid, overprescribed abuse situation never really happened. Most of this started in 2010 when the abuse-resistant formulation of OxyContin landed. Purdue did some bad things, but they did that right. And when people couldn't snort or abuse that drug, heroin deaths started to almost immediately that year, after 2010, to grow. So number one, that's important. Number two, the deaths specifically from opioid prescriptions has remained stable at 3% per year from 2009 to the present. Thirdly, the issue of the CDC guidelines still remains, and it's becoming weaponized, not by medical boards so much, but by the legal profession, as well as the people that control our lives. And I will go back to the 1990s when all insurance companies stopped paying for adjunctive pain care. No PT, no psychotherapy, no biofeedback, no acupuncture, but we'll be happy to pay for opioids. That was the late 80s, early 90s. And it was 10 years later that pain became the fifth vital sign. And again, the only tool in the box were opioids. So this has a lot to do with where we are. Very few people talk about insurance companies who still use the CDC guidelines as reasons for not approving pain medications, not approving what patients may need. Finally, the law is such that there's a law trying to be passed right now by folks, 2 senators, that would try to get the FDA to state you can't use pain medications for longer than a short, maybe a month or 2 period of time. It's, I can't remember the exact name of the act, but it's to diminish total use of opioids for everyone.